All right, so now we're going to talk about neurologic disorders and how they might affect pregnancy. Epilepsy is a fairly common neurologic disorder. It's seizure disorders. Preconception, ideally, a lot of anti-epileptic medications actually can cause birth defects. So ideally, we're evaluating this patient for their meds and their recent seizure history prior to conception. We want them to have minimal seizures, and we want to make sure they're on the safest anticonvulsant possible. There are some risks to anticonvulsants. A lot of them can cause cleft lip and palate, sometimes congenital heart disease or neural tube defects. So we want them to be on the safest meds possible, but seizures are riskier than the meds, so they've got to be minimal seizures. Also, we want folic acid supplementation because those seizure meds can cause neural tube defects. With a seizure, we've talked about potential congenital anomalies because of the anticonvulsants, but if they don't take their meds and they have a seizure, the fetus is not getting perfusion from the placenta, the uterine contractions in a seizure can cause placental abruption, or they can just suddenly expel the fetus because of those uterine contractions in the seizure. Frequently, neonatal vitamin K deficiency already exists. It tends to be worse if they're on those seizure meds, and intrauterine growth restriction is common. Management, folic acid supplements. They need a prenatal vitamin with vitamin D. Whatever is necessary to control a seizure should be done. If they have a seizure in pregnancy, controlling the seizure is priority one, okay? If it's possible, taking only one medication at the lowest dose that keeps that patient seizure free is going to decrease the risk of birth defects. In labor, it can be a challenge to maintain their anticonvulsant levels. So seizure risk can happen in labor because they may be vomiting, they may not absorb as well. So sometimes they may need IV seizure meds. Vaginal birth is preferred. In the postpartum period, there's a risk of toxicity on those seizure meds because of changes in the way they're metabolized. So we need to be monitoring levels postpartum. Breastfeeding is safe with most anticonvulsants. Topiramate is not recommended. Breastfeeding is not recommended. Multiple sclerosis is a disorder in which patches of the spinal cord and the central nervous system lose their myelin. It's called demyelinization. That decreases the ability of the nervous system to transmit messages. Remission is common in pregnancy, so someone who has MS may go into remission in pregnancy. Sometimes pregnancy triggers an exacerbation. That's more often in the third trimester. There is no evidence about the safety of MS drugs, but most of them, the molecules are too large to cross the placenta, and they have not found any anomalies yet. If the patient is paraplegic, they're at risk for UTI, and they're at risk for an unnoticed onset of labor, so they need to be monitored. Someone with MS can use an epidural. Vaginal birth is preferred, but due to weakness, they may need assisted vaginal birth. We also need to assess women with MS for postpartum depression because depression is a feature of multiple sclerosis. Bell's palsy is an acute idiopathic facial paralysis that is common in women of reproductive age. It has a higher incidence of pregnancy. There's no known effects on the fetus. So the focus is on resolving those symptoms for the mother as soon as we can. Steroids can be helpful if they're administered in the first 5 or 6 days, and then preventing injury because of that paralyzed face. Okay, next is going to be autoimmune disorders.